Well, what is up, everybody? Welcome to the Pain Sucks podcast, our Facebook Live edition. We've got a super program in store this morning with my good friend, Dr. Lou. And it's funny because we've known each other a long time, just through different
living days, even before
chiropractic avenues and seminar things. But I know that a few years ago, and this is why I'm really excited for this morning. By the way, Lou, if you want to see like any questions that people might be asking, if you go to the Pain Sucks podcast Facebook page, and then you can just like be a watcher and you can see things come up as people ask questions. Anyways, let's go back. So we've known each other a while. And then a few years ago, one of the things that I wanted to do was add hyperbaric oxygen therapy to our practice because of the wonderful benefits I've seen you talking about. And then through a mutual friend of ours. So everyone, I want to introduce you to a good friend of mine, Dr. Lou Hilliard in Atlanta, Georgia, Hotlanta. South, baby. But listen, Lou, I want you to tell everybody a little bit about your journey, because I know that by profession and by your degree, you are a chiropractor. Yeah. But I know that, like, you know, you're one person that I've always found is not like ever in that little box. Like, I know that you love our philosophy because it's real and it's true. But I also know that you're like one of these guys that's like, people are important. And I know you're a huge lover of people. People follow you on your Facebook page, know that. So listen, give us a little history of who Dr. Lou is. How'd you get to where you are now? And really what I want you to do is talk about why you're the expert in this mild hyperbaric oxygen therapy today. I'm going to let you go. Say hi to everybody. Just give us a little.
Hey, everybody. How are you? Well, you know, I can't, you know, I'm humbly said, thank you for saying that I'm the expert. There's so many people that are helping move in this industry now that are being involved, that are key into the movement. But I think where my roots come, and as you said, was really where I came from, you know, being a graduate of Life University, working with Dr. Sid being a wonderful mentor of mine all through school, and even after school, just having a great personal relationship with him. I learned to develop literally and live a lifestyle what's called by the lasting purpose. I give, I do, I love, I serve, and I do it without any expectation.
Right.
And because of that, God has blessed me and blessed this industry so much with a tremendous amount of abundance, but also with a tremendous amount of impact, where we're able to touch people and serve people, not because of trying to make money, but it's all about what? The intention and the integrity. That's what Dr. Sid used to talk to me about. Eagle, make sure you have intention and integrity. Right. Okay, Dr. Sid, and everything that I do, that's one of the major, that's my foundation, is the lasting purpose, as well as doing things with integrity and having the right intention with it. With that being said, you know, I started, of course, when I graduated Life University, I was a chiropractor, successful chiropractor. I loved adjusting my patients. I love releasing the very power of God with them and literally helping them and seeing them heal and get well with just the power within their very own body. And we that's what we talk about, is really what the major premise of chiropractic, of releasing the very power within by adjusting the vertebral subluxation. Well, I just took that another step to the right or left, still following the same principles of treating a patient, or not treating a patient, I shouldn't even say that, you know, taking care of a patient and helping them reach their God-given talents by not letting them have drugs, surgery, anything that's invasive, but literally helping their body heal and function better. By what? And really what hyperbaric is by giving them a breath from God. So chiropractic, we release the very power of God with them by delivering adjustment. Hyperbaric, we give them a breath from God. So, and then there again, non-invasive, non-toxic, and that falls right in line with my whole philosophy in how I want to treat my patients or taking care of my patients, or even how other doctors are taking care of their patients. If I can influence them to treat a patient or take care of a patient in a way where it's not going to cause them to, prescribe medications or harm to them, that's what I'm about. And that's really how come Atlanta Hyperbaric Center has grown so much. And now it's not even just, within a state or a city or even the country anymore. We have gone globally. And now it's not even just about selling a hyperbaric chamber, but it's literally about helping people become very successful with their chamber. And now we're training doctors and physicians all over the world on how to become successful with their chamber.
Yeah, and I've watched you grow from even when we first started talking, and I mean, nothing you ever do is small-minded. Everything you do is big. When we were talking, though, I mean, I was impressed, how many of the NCAAs and the NFL, and you were always posting this celebrity or that athlete. And it's I think one of the things that was impressive to me was that, the people who want to be the best at anything in their field, particularly athletes, right?
Yeah.
They're always looking for what's going to give my body the most optimal opportunity to be its best. And I think that's what you were just saying. You were tapping into that need. And it starts up there, I think, a lot of times. But then I watched it trickle, and I watched some of the stories that your patients were telling and recovery from different diseases and all the different things that were happening. So here's what I want to do, because I actually
– Can I say something real quick? Do you remember – I'll give you a time, and I'm almost positive you were probably here or we were probably definitely at the same Maximize Living seminar 2006, 2007. Yeah. We were in Colorado Springs. Do you remember? Were you ever there at that?
Yeah.
Did you do the Manitou Incline?
Oh, yeah.
So let me tell you the origin of hyperbaric and how it got in there.
All right.
So Matt and I, we went to a Maximize Living seminars, and we were young, bustling, thriving chiropractors, but also we challenged ourselves. We were into taking care, of course, of health and training. And so we would get up in the morning, 5 o'clock in the morning, run, every morning, which I still do. So I'm not saying it's not a bad thing whatsoever. But when we would meet up at the seminar, we met up at Colorado Springs, and they have this huge steep incline called the Manitou Incline. So at 5 o'clock in the morning, the whole seminar, 500, 600 doctors, goes up to this Manitou Incline, and at the top it was majestic, I thought, but off in the distance I seen Pikes Peak, and I was in awe at that, but also I was in awe, of course, what we just accomplished going up this incline that people from the Olympics that are training, because the training center is right there in Colorado Springs, they're using every day. They're running, and all of us are needing oxygen to go there. But when I made it to the top of that, to that Manitou Incline, I was like, I want to climb that mountain, Pikes Peak. Yeah. Well, I ended up training for it and climbing it. But I remember when I was at the top, and actually when I came down from summiting Pikes Peak, this was now, I'm moving forward several months into this now. It just wasn't right after the Manitou Incline. I said, you know what, I'm going to keep on going, which you can. In the trail line, because it's a 13-mile trail line to the top of the summit of Pikes Peak. So, make a long story short, when I came down from climbing that mountain, my body experienced levels up at 12 or 14,000 feet, where there's a minimal of oxygen. So my body was hypoxic, and my body went through some crazy changes that first and second week off of the mountain that I've never experienced. Not when I went up there. I went up it just fine. I was in top shape. And I actually remember doing at the top, I went and did 500 push-ups for a charity. And then I donated the money. I can't remember exactly what it was for, but long story short, that's how I got involved with hyperbaric, was climbing that mountain, but it all stemmed from being at Maximize Living, doing the Manitou Incline,
Wow.
seeing that mountain going, I got to go do that.
Yeah.
And maybe that's my mentality. You know, everything I got to do, I can't just do it small.
Right.
I can't do it like regular people. I got to go take it to another level.
Yeah.
You know, and so then, of course, I went and climbed Pikes Peak. And, of course, that was a tremendous experience in itself. And we're not here to really talk about it, but one day I'd love to share with you the climbing of that mountain and doing it alone in February. So, or was it March? I think it was March, excuse me. But anyways, so with that being said, that was the birth of Atlanta Hyperbaric Center, because when I got off that mountain, I was like, I got to find a way to get oxygen in me.
Right.
Because so now I'm aspiring. I want to go climb, you know, bigger and better mountains, you know, and get into the 20,000 foot and the 30,000 foot. And, you know, of course, everybody wants to go Everest, or if you're if you're crazy and stupid enough to climb mountains, then you aspire to climb Everest, but which I would love to do it still. So with that being said, when I came down, I started doing research, and nobody heard of hyperbaric at this time.
Right.
Nobody was like, hyper, what? And I found this company that was just starting up, Summit to Sea, and they probably had maybe a couple of chambers, you know, sold, and I was like one of the very first ones that bought the vertical chamber that looks like an igloo, just like the one that you bought. I owned one of the very first prototypes of that. So, and I remember, and it was like, you know, the price was still around $14,000. And I was like, well, how am I going to be able to justify and pay for that chamber? And I just don't want to pull $13,000 on Tropic. So what I did is I went to about 15, 20 of my best patients, family members, and I'm like, hey, I'm going to get this new, improved, amazing machine. It's called a hyperbaric chamber. And, you know, then it was like, a hyper what?
Yeah, exactly.
Crazy. I'm going to start Atlanta Hyperbaric Center. And I remember I went to doctor's offices, and of course I went to my patients and my friends and family members. I was just trying to get people to prepay before I got the chamber. I didn't even have the chamber yet.
Building the business, yeah.
But what I did is I got like 15 people to give me $1,000 each. And what I did, so I had more than enough to pay for the chamber.
Yep.
We all had unlimited. I gave them unlimited hyperbaric use in my chamber. That lasted in all but 3 months for most people. I think I had probably 2 other people that came in for about a year, which I was very happy to serve because they helped me get started with Atlanta Hyperbaric Center. So if anybody's listening out there, you know, just know that, you know, if you don't think you can do it, you know, you got patience, you got a following of people, man, that will believe in you. And if you have enough conviction and believe in what you're doing, people will see that and they'll invest. You know, not everything you have to do it with your own money. So, and that's what helped me get started.
Gotcha.
With that. And then from there, being one of the only hyperbaric offices in the private ones, other than hospitals and wound centers, everybody else thought it was just crazy, especially chiropractors. There wasn't too many chiropractors doing it. So, but I kept at it, and then of course it just started taking off. And then it went from one sports team to another. Of course, I mean that's the limelight ones.
Right.
But, you know, it went from one mom to another parent to another grandparent to somebody else coming in to another child getting better to another child seeing miracles and somebody else's life being saved. You know, the results that I started to see with chiropractic, I've seen amazing results, adjusting the spine, releasing the very power of God within their body. But as soon as I put in hyperbaric and I combined the two together, the results were phenomenal.
Absolutely.
And really, and I wasn't doing anything.
Yeah.
I wasn't doing anything. I just moved a bone. I pressed on somebody's back, the bone moved, and I put them in the chamber, and they come out, and I said, come back again on, 2 days or 3 days later or next day or whatever it was, and they did. And the more they came in, the better they got.
Yeah.
And it wasn't like little results. It wasn't like, oh, I'm feeling better from my headaches. It was like, things are changing. Things have improved tremendously. And I'm kind of vague on some of the stuff just because, I don't want to get into people thinking like, oh, it's going to be able to cure me, because I'm not saying that, what these chambers are approved for or cleared by through the FDA and what people are using for in the office. There's a line there.
Yeah.
And there's a lot of, and sometimes there is a lot of skirting with practitioners, of course. So you have to just watch what we say and what we do, because it could be taken, people can misconstrue it. But a wonderful, wonderful therapy.
Yeah. So one of the things that, and I'm totally aware, like you said, of how we talk about it, but so I have two quick things that I want to take us down this path real fast. And the first is you bring up some of our past and some of the things that we learned. And I can remember there was a time, and this is totally true if you think about it, and the people that are listening right now that are dealing with pain and disease, understanding that the two most important elements that we need for healing is nerve impulse followed by oxygen. That you can't live if you cut the nerve to someone's heart, they're dead immediately. Yeah. And then if you restrict oxygen, they're dead within minutes. There's nothing like it's not even about vitamin D anymore. Like it's and then it's oxygen. And so like what you're telling me is that like all you did was step in and you go, hey, listen, the second most important element that people need, like we have a way to deliver that. So what I want you to do real fast, because I got a text last night from someone who said to me, isn't hyperbaric oxygen therapy for scuba divers? And that brings me to this question for you. Mm-hmm. Talk us through a quick history of this therapy. Mm-hmm. And then I know that we're allowed to talk about science. So hit us some history. Talk us through a red blood cell, talk us through some plasma, and then if you could tie it, Lou, into like how that deals with inflammatory processes of the body. Just hit us with some history and some science for the people that are like, I don't know what else to do, but this sounds pretty cool. Yeah.
Well, of course, what is the most important nutrient that we need? It's oxygen. Just like you said, and we can't live 1 second without proper nerve impulse, and as you said, and then of course the oxygen is so vitally important. What happens when you get into the hyperbaric chamber is that there's a couple natural processes. Just like remember when Dr. Sid would drop the keys in gravity 100%, or when you let go of those keys, they're going to fall. Well, with hyperbaric, there are natural laws that fall in place that work 100% of the time. Henry's law and Boyle's law. And pretty much it's a gas under pressure will dissolve in fluid. And that's really what the short version is of it. So when you put, and if you think about it, think of like sugar water and carbonation, and you put it under pressure, and what do you get? You get a soda or pop, or wherever what part of the country you're from. But right. you get a soda pop there, and it has those bubbles. And as soon as you release that pressure, you'll see all of that gas escape out of the fluid, but you didn't see it when it was under that pressure. Well, that's the exact same thing with hyperbaric. Okay. So when we put you in the chamber now, that pressure is going to push the oxygen that we're breathing into not the red blood cell. Now, not just the red blood cell, not just the plasma. That's through the normal respiratory process, meaning that we breathe in air, it goes to our lungs, to our alveoli, and then there's a gas transference of CO2 and oxygen. And then the oxygen is delivered by the red blood cell. That is only 7% of the body. So if you imagine this, you're taking 7% of the body, red blood cells, and you're delivering that red blood cell with around 21% oxygen that's coming from the air. That's how much in the air oxygen is, 21%, 70% nitrogen. Let's move on. Now with hyperbaric, that oxygen is not going to go to just the red blood cell. It's not just going to go to through the plasma. It's going to saturate all of the fluid of the body. And how much of your body is made of fluid? 72%. So now you've got 70% of your body delivering oxygen instead of what? 7%. And then you can couple that. If you go to a hospital, you're going to that oxygen level can go up to 100%, like in a clinic setting, or in a mild hyperbaric chamber. You can use an oxygen concentrator, and they advertise it to go up to around 96% oxygen. So instead of just 21%, you get the oxygen concentrator. You put a mask on. Now you're going to get around that 96% oxygen. And so now you get 70% of your body delivering 96% oxygen. What do you think people are going to want? 7%, 70%, of course.
Right.
We want the later of it all. And that's really what hyperbaric does. Now, what does it do specifically for the body? There's studies out there, and there's approvals by the FDA for limited conditions. And there's 13 of those conditions. But with the mild chamber, it's only approved for hypoxia or acute mountain sickness. That's it.
Right.
Even though it follows the same natural laws, a gas under pressure would dissolve in fluid. So whether you have a high pressure or even a low pressure, you're still going to get that physiological effect of the gas transfer or the gas being dissolved within the fluid of the body. It's almost like turning on a spigot. Either you turn it on a quarter turn to fill up the bucket, or you're able to turn it on a full turn.
Right.
Okay. Now, with that being said, frequency and duration is always key.
Yes.
And not everybody. So many times I have customers or even patients coming to calling me up going, "Hey, my doctor is seeing me 2 times a week for 30 minutes each time." And I'm like, that's not going to do anything. And that's but also, what is this therapeutic effect? Because it's such a new and emerging, the mild hyperbaric is such a new and emerging field that really nobody knows what the proper dosage or therapeutic frequency and duration really should be. Now there is, within the last 5 years, every year I go to the hyperbaric seminars, and there is more and more. Where 10 years ago, 12 years ago, when I first got into this and beyond, people laughed at mild hyperbaric. They just they shut their doors on me. They, ha ha ha, this ain't gonna go. Now the science is out there. It's starting to show that it has promising effects for TBI and concussion and stuff like that. Has it been approved or cleared to use by the FDA? By no means. Should you say that in your literature? I don't think that would be a wise thing to do. Right. But just know that there are patients that are going to come in with different elements because they heard it from a TV show or from a news blast or what have you, of the positive effects of hyperbaric and mild hyperbaric.
So how long has the therapy been around? Like when,
the therapy's been around over 160 years. It started back in the 1820s. They had the Dycentennium, and this was like a big round ball hyperbaric chamber. Okay, and then it's just kind of slowly progressed over the years, and then how it got into the mild stages is that there was a mountaineer, and he made what's called the Gamro bag, and it was a more of like a foot pump that you would bring to you when you're climbing mountains. That would be a foot pump, and if somebody would have altitude sickness or hypoxia, they put them into this foot pump chamber and increase it, and that's really where the birth was of the mild hyperbaric chamber. So, and then the mild hyperbaric chamber just adopted that same technology, took off the pump and the foot pump and put on a compressor.
Gotcha.
And plugged it in the wall.
So when I climb into, all right, people can obviously Google, what one looks like, but when I climb into one and it gets zipped up, these pumps then turn on, and what they're doing, what you're saying is they're actually compressing the oxygen gas to a point where then science takes over and the fluids of the body are accepting that oxygen more than just our breathing pattern. And then therefore our body is being delivered a massive amount of oxygen, which you said is the second most important thing and the first nutrient that we need. Is that kind of a decent summary?
Yeah. I think that's very cool.
So let's spend a minute. We'll talk to the doctors in a second, but let's talk to the people right now, because, people have researched this. They've reached out to me and said, is this something viable? I'm in a lot of pain. I've got herniated disc. I've got back issues. I've got pain as a result of a disease process. And I get that first of all, nothing we do cures the body. The body fixes itself. So the point is, like, what can you say to these people, or what do you say to people that reach out and say, hey, Dr. Lou, I see Atlanta Hyperbaric Center, and this is my condition. What do you? They understand the science, maybe the simplicity of the summary you gave us. What do you tell them?
I mean, when you put somebody in the chamber, there's no telling on what's going to improve, and how long it's going to take. There's just no telling. Everybody responds to it differently. Yeah. But when you go in that chamber, things are going to start happening, and good things start happening. I have seen people, everything from senses improving to, performance and sex drive improving. And these are all very, very common positive side effects of hyperbaric. Right. There's nothing better than having an 85-year-old man, and he comes up and says, "Hey, doctor, come here." I'm like, "What?" Yeah. He said, "You didn't tell me that this is, I'm like, "What do you want?" He's like, "Doc, I feel like I'm 20 years old again." Right. And him and I had an enjoyable laugh, and I'm sure he enjoyed it tremendously. Not because also that was happening to him and it's waking things up, but it was just, it's about changing people's lives, making a difference. And I think that was one of the best things about Atlanta Hyperbaric Center was, how can I keep on impacting somebody's life and in touching with them, whether I can share a laugh, share a dream, share a hope, as well as, be able to impact them by giving them hope and giving them something that maybe that they're missing. Because a lot of times I've seen that, okay, not just the hyperbaric chamber and the adjustment, sometimes they just needed a hug. Yeah. And they started getting well again. So, and that's really what I was about and still am about with hyperbaric and in chiropractic with my patients and customers.
Can you scientifically draw a conclusion, through data or not, that shows that someone that adding higher levels of oxygen and handling inflammation better, because we know inflammation can't live in the presence of oxygen? So could that alone be a reason for someone to use hyperbaric to handle pain things that are happening to their body?
The major premise of hyperbaric is, well, maybe the second premise is literally the effects of how it affects with inflammation.
Okay.
Because the inflammatory process is really what the beginning for most diseases. We talk, with heart disease, we'll have inflammation of the arteries, and in cancer, we'll have inflammation normally around an area, wounds or what have you. So it's usually one of the very first symptoms, but also with hyperbaric, it's one of the very first that's able to affect because of the oxygen. Now, do I have the studies right off the top of my head? No, I don't, but they're out there. All you got to do is a simple Google search, hyperbaric oxygen therapy and inflammation, and you're going to get a host of 2 or 3 pages full of different studies that are out there. Not just with when you look at studies, you have to find out what are you looking at, because hyperbaric is broken up. You have your high pressure chambers, which are your 1.5 to 2.0 or even up to 7.0 or higher. Those are ones you're going to find in a more or less like a medical office or a hospital. And then you also have your mild chambers, which is your 1.3 or lower. There are studies out there for both. So when you're looking for research, don't consider the research that's going for the higher pressure ones and be able to justify it for the lower pressure chamber research that is out there. Now, and as I said, 5 years ago, there was very, very little. Today, there is more and more, there's starting to come a lot of evidence out there that is showing the treatments, and it's showing definitely positive effects. And these are big studies for PTSD, traumatic brain injury. They're showing also studies that are showing positive results for some of the wounds and some of the autism and stuff like that. But can we say we treat that? No. Can we say we're going to use it for that? No. Can we say we're going to prevent that? No. Because if you mention any of that, if the reader or the patient misconstrues it, then they could be liable. So we just try to minimize what we can say and what it does.
Yeah. I mean, we're all very aware. I think that there's growing awareness in the country that the government agencies don't want to let go of and also they are very, very slow to hand out approvals to things that we know actually work, as we know that takes away from other things. However, let me ask you this, because someone had just private messaged me this one. What's an experience like inside of a hyperbaric chamber? I mean, like when I get in there, you talk about using pumps to pressurize. Like, what am I going to experience? Oh, someone just said I am claustrophobic. So maybe give us a little experience.
Those are great questions right there. So the first one, what are you going to experience? Well, one of the things that people don't realize is the heat factor. That the smaller the chamber, the more the heat is going to build up. And that becomes an issue when you're in there for an hour, maybe 2 hours, if whatever, or some people even sleep in there. I have slept in there a bunch of times as well. But I don't condone that. But
there's a nap.
With that being said, the experience is going to be, you get into the chamber, the first thing you're going to notice is you're going to notice pressure in your ears. It's just going to start to pop a little bit. Eventually, if it's your first time, and 5% of the people, they're going to bug out. Doc, what's going on in my ears? It's going to, because it does at your first time doing it, it feels like your ears are going to explode because of the pressure. And that's one of the first things that people don't realize when they get into a chamber. Now, there are inflation techniques that you can do to minimize the octic barrel trauma, that's middle ear pain. There's different ways how to do it. You can stair step, you can slowly increase and just instead of just shutting the valve completely and doing it, you can just slowly increase it gradually. So instead of a typical normal inflation, if you just close the valve on one of these chambers, is going to be around that 8 to 9 minutes or 7 to 9 minute mark. So if it was somebody that had any type of ear pain or sensitivity, I might do it 12 to 15 minutes before I bring them all the way up to pressure.
Right. So you're going slow as they acclimate. Because I know with me, I definitely felt the ear stuff, and I know it's a small percentage that do, but I did. And I like some people like, what does that feel like? I'm like, it's kind of like if you're taking off on an airplane and you just get that, and you're trying to you're not like, and then but like you said, it's just a couple minutes and then it pressurizes. Yeah. Then you're good.
Yeah, and once it pressurizes, so of course what we do is we always, we try to instruct patients to open and close their mouth. They can do the Valsalva's maneuver, something where they can just bear down and clear out their ears, whatever way possible while they're doing it. But also that ear pain only lasts, your first few times. And after that, then it's just like getting in there, and then you won't even bother you anymore after a couple times of it. The second thing which I already talked about that people don't realize is the temperature. If you get a really small chamber, and especially if it's small chambers used one after another, especially if it's in a clinical setting, that chamber is not going to cool down, and it's just going to be a hot box. People are not going to want to, follow through with their care plans. So always try to make sure that the temperature is much more cooler on the outside than it is on the inside is going to be a great thing. Now with claustrophobia, really claustrophobia has to do with control issues. Like if you get locked into an elevator, there's no way you can control it and get out. You're going to bug out. With hyperbaric, it's not about control because you can get in and out of it anytime you want. So it's just you just have to relax and just enjoy yourself in the confined space that you're agreeing to. So I let my customers or my patients, do close the door, the zipper on the chambers, so they know that they're in control of it.
Right.
But also what I also try to do is within the clinic, we have large chambers. So we try to minimize that. There again, if you get a small chamber or mid-sized chamber, it's going to feel like you're very constricted. There are chambers out there, even of my competitors that are 21 inches or even smaller that are just, I couldn't get my leg in that.
Right.
But yet there are people, getting their whole bodies in there. How? That's like more or less like a hot box.
Right.
So with that being said, some of the things that you need to be, when you're experiencing the chamber, you want to know where things are at. First of all, also understand that you're in control of the zippers that we discussed, but there are valves that the customer or the patient's able to control.
Yeah.
So they can control the pressure from the inside or from the outside. They can get in and out of it from the inside or outside. Also, communication is just as much at a tone that you and I are talking right now. That you can be in the chamber, I can be outside of it, and nobody would ever know the difference in the tone of our voice at all. You don't have to go, hey, you understand me? Right. Do you understand the words that are coming out of my mouth? No, we don't have to worry about none of that. So with that being said, you can just talk to somebody very, at a normal tone. With that also being said, when you're getting somebody in and out of the chamber, one of the most important things that you want to do is protect that zipper. Making sure that nobody's hanging on it or that you're pulling it apart to the point, because that's the weakest part of the chamber, that you're helping that chamber get in and out of that, or helping the patient, get in and out of the chamber to avoid any structural damage on that zipper is extremely important.
Yeah, that makes sense. And then, so if I'm in there, so like, I'm in there, I'm comfortable. I got 55 minutes in front of me.
Yeah.
My experience, the first time I was in there, I had like a lot of energy, like the first 20 minutes or so. Like I was like watching on my phone. I think I was doing a Facebook Live, like I was tweeting, like, or might have been watching Netflix, answering emails. And then I noticed the last half of it, like I almost got like sleepy. And I was like, just in this really relaxed, calm sort of state right now. And I'm assuming, and you tell me if I'm right, that was just that oxygen diffusion that was taking that time.
Well, there's that, and there's that hissing sound of the air.
Oh, right. Okay. Yeah.
And I cannot last 10 minutes. I don't care what I'll bring into the chamber with me. I have brought work. I have talked to people on the phone. And I'm like, I got to go. And literally, I can't last 10 minutes without sleeping. And when I sleep in that chamber, I'm at the point where I wake up with drool coming out. I'm like, what is going on? Because it's such a deep sleep.
Yeah.
And to me, I don't know if it's, of course, I think it's part of the being enclosed. And it's just like, so if anybody, if you're stressed and you feel like you're being bombarded by life and the kids and the bills and the whatever life is handing to you, when you get into this chamber, it's almost like it's just you.
Yeah.
I don't know if you got that same effect. So you can almost like, it's almost like when you're a kid, you can lock yourself in the closet. I don't know if if anybody do it, but you get into the chamber and you gotta lock, put yourself in the chamber, and it's like it's just your time.
Yeah.
And for me, then as soon as those pumps are on, and I get that hissing sound from the valves, bam! I just pass straight out. I'll sleep about 40 minutes, whatever, and I'll wake up. And I don't know if you've experienced this, but you wake up tired, more tired, and it takes you a little bit to get acclimated and back going again. But after about 20 minutes of being out of the chamber, then bam, you're like a rocket, and that's what always happens.
I'm glad you said that. That's totally how I feel. And I would say probably everybody that we've ever, like when we unzip and let them out, there's that look of like, can I just lay down here for even longer? But then just with conversation, maybe they got to make a payment at the front or reschedule. Like you see like their energy come back. And I think that's the process of that whole diffusion we're talking about under pressure. And it's a normal thing. Here's the one thing I want to say. So so we had a lady come in one time, and she was going to run a 5K like in a couple of days. And I don't think I actually had any interaction with her at this time, but so she did it and got out, and then like 3 days later left us a negative review about how it doesn't work because her 5K time was the exact same. And I thought to myself, this is so interesting because, and I want to address this right now, especially for all the people I see watching who are going through pain, and you follow our podcast on pain, is like, listen, this is something you have to commit to like anything else.
Yes, I'm glad you brought this up.
And Dr. Lou and I both are very, very clear that the science is emerging, but that right now, anecdotally, is really all we have. And all we have is like what we're watching as people use it. And I can tell you right now that I've actually got to the point where unless somebody committed to pretty much 3, 4, 5 times a week for a bunch of weeks, it's really not like kind of almost worth it for them, depending on the outcome they want. Because one, it's kind of like taking someone who's been starving for a long time and trying to get them to eat an extra large pizza. Like their body can't figure it out. So to put this amount of oxygen in, think that the body knows what to do with it immediately at that level. It has to prep and has to learn. And so those of you listening, first of all, number one, if you have a place around you, and we'll give you some resources at the end, maybe Lou, that people can click on a link and find like a local place if you've got something like that. And then, but listen, commit to it, and then just understand it's going to take time. Like very rarely does someone get out of there and go, all my problems are totally solved after the first one. It's like, but you watch after a couple weeks, and you just watch lives change as people commit to adding this nutrient. Would you say that's your experience as your clinic director as well?
Of course, it's always patient compliancy, and there's nothing that, of course, that bothers a physician, I think, more than when you have a patient that comes in, they're expecting a miracle all in one visit, and then they would do something like that, which is quite, it happens, sometimes. Yeah. And it's like, no, this is not something that you can go in for one time or one time for a half hour, once a month.
Right.
If you're going to come in, you're going to have to listen to my care plan. You have to listen to my recommendations.
Right.
Because I don't want you to go and leave that negative review and say hyperbaric didn't work for you or this didn't work for you. Right. No, it was because you didn't follow the care plan. So compliance is, I think it's, and talking to, we're chiropractors. I meet a lot of other medical doctors of all sorts of professions in there, but they all say the same thing. We all have the same problems and frustration. That is patient compliancy. Do they actually follow what we recommend? Right. And 9 times out of 10 is no. And then what they do is then they go and leave a bad review when all they should do is, just take a look in the mirror. And did you do your best? Yeah.
We're not coming down on everybody. It's a human condition, but at the same time, we're very clear that mild hyperbaric oxygen, Lou, is definitely not an a la carte thing. I mean, it is not. It is. But listen, there is, in my opinion, there's very few things out there that have the ability to do what it will do if you commit. I mean, it really, truly, honestly, and this is coming from a clinic where we have all kinds of anti-inflammatory therapies here in this office. Yeah. This therapy, this machine can do something that very few other can do. It just takes time, but that's really like how the human body works anyway.
Yeah, healing takes time, and that's it, man. If you just give it the time, right? And it's a commitment. Yeah. If you commit to lose weight, you don't go to McDonald's. You got to commit to eating right. So this is a commitment to getting well. But I promise you commit to it, the rewards far outweigh. The amount of results and the miracles that we have seen and patients have seen is astronomical and almost awe-dropping.
Yeah, across the board. Across the board. We're not even talking about, my back hurts. We're talking about the most difficult diseases to treat are seeing amazing things with commitment. Let's shift real fast because we've got a couple minutes left because I think this is important. So there's a huge reason why docs, and I'm going to talk to the chiros out there because they're our tribe, but it's bigger than that. There's a reason why you need to have this. Lou, speak to that. So listen, Lou's the guy you go to get it. And so this is, and he's a humble dude. So this is not a plug. This is him literally pouring his heart out right now in the next 2 minutes, telling you why this has to be a part of your office. You don't need a lot of space, and you just need an electrical outlet. Yeah. Really. So why is this so important in the world of trying to get people better?
It's everything, man. I mean, there are people out there. They're in our communities, and they are praying for us. They're crying for us. They're praying for us. They have been let down. They've been lied to and lied to and lied to over and over again. And where they're given false hope and false dreams and false lotions and potions and pills to do what? They do absolutely nothing but get them further in debt and take away their health. So what is it? Who's going to do something about it? If I don't do anything about it, nobody else is going to say anything. If you don't do anything about it in your community, where are they going to get it from? Right. Because this is really not a technology that has been out there everywhere that can affect an entire nation. And with chiropractic, you are not there. It's just a simple side step to the right. You're doing the same thing, non-invasive, non-toxic, and you're able to make tremendous results in saving people's lives, saving them money, saving their health, saving their lives, and just literally, but taking it with some compassion. Right. So this is not something like when I talk to people, what is it worth if you lose a limb? What is it going to cost you? Millions of dollars for therapies, surgeries, over the course of a lifetime. What is it going to cost for your child or somebody that has autism? What does it cost for treatment? Thousands, or if not hundreds of thousands of dollars or millions of dollars over the course of time. But you spend just a few $1,000s on getting a hyperbaric chamber, few thousand versus several $1 million, there's no comparison.
Right.
So, and that's what I try to talk to people about is that, put it in perspective. If you put it in perspective in what you can offer your patients, what you can offer your customers, and the cost effective of it, and it's all about what the ROI, the return of investment. Well, if you really want to know the business side of it, instead of what we're trying to do is really save lives, there is a business side. Of course, that we've already talked about. You can, if you speak with the right conviction and you speak with the right intention, that you can get people that are going to pay for your care plans. They're going to help pay for your chamber to help you keep your dream going, and they're going to help, fund your dream and keep it alive. But also, most important, keep referring people. Yeah. So that in there in return. Oh yeah, just real quick, just by this video, I got a referral from a Dr. Tim. So that's how things go when you put energy in. You start getting referrals. People start noticing. Some doctors, if you feel like you need something in your office, or you just feel like you want to offer something even more, this is not a therapy that's, okay, it might work or what have you. This thing changes people's lives. I've seen it 1,000 times.
It absolutely does. So right there, where can and I'll put this in the show notes. Where can a doc reach out to you? Where can they find you? How do you want them to reach out?
Also get a professional discount.
Okay.
All of our chambers. They can come to or go to AtlantaHyperbariCenter.com.
Okay.
Okay. They can also email me at info@AtlantaHyperbaricCenter.com.
Okay.
As well as, they can go on there, choose. There's a chat box. I have some people that are working my chat that could be answer their questions. If they need to get a hold of me, put that in the chat, and my sales people will refer it or send it right over to me, email it to me, and then I can call you and be more than happy to help out in any way.
Is the best way for a patient listening or a potential client listening, is the best way for them to know if there's something in their area just to throw like hyperbaric oxygen therapy and their zip code in Google? Or is there a database where people are, is there anywhere locally that of that people can go, can go in and see if there's something, or is that not really there yet?
No, it's not there yet. With that being said, one of the best things you can do is just type in hyperbaric therapy near me. Okay. Or, find out hyperbaric chiropractors near me. Usually, chiropractors are going to have this in their offices.
Right. Okay. So right now, guys, unfortunately, and I'm sure Lou, as he's heading up this whole movement, has probably had this in his mind of a database of docs and places people can go. But that brings me to my last question before we sign off and say our last little bit. Are people themselves allowed to have hyperbaric oxygen therapies in their home, like a non-professional? Can they do that?
Yes, that's a great question. I'm glad you brought that up. So in order for a patient to have a hyperbaric chamber, they have to have a prescription. Okay. So they can get a prescription from any of their primary care physicians or treating physician, where they're coming from. But you have to have a prescription, and doctors, you'll have to show a medical license. Okay. Now, we do offer discounts with veterans. And veterans, if you show your DD-214 or Veterans ID, we thank you for your service. We give you discounts. Healthcare professionals, there we go, the same thing. And law enforcement and first responders. So every one of these special groups, if you've been in either one of them or any one of them, you can receive significant discount. And already my prices are pretty much discounted more than than most of my competition, and also we guarantee to beat every price. And one of the things, man, I love working with our healthcare professionals and, of course, the chiropractors. So, you know, if there is somebody that's going to respond from this video that wants a chamber, I'll give them an additional $200 off. And all they got to do is just mention MM for Dr. Matt Malonis.
All right.
You put him on there, we'll give you an extra $200 off on your chamber, and we'll take really good care of you.
So I want to say thanks for your time today, and I really hope that people do some Googling in their area and get into some offices. I also hope that the docs that watch this, whether they're watching or listening to the podcast on audio in a couple days when it's out, take you up on that, because it's a huge blessing. The therapy is a huge blessing to have, and I mean, we could talk about it all day, but Lou, listen, thanks for being here, man. Just give us one last little like piece of glimmer of hope. Tell our people listening who are looking for some more health and healing from disease. You know, give them a little bit of the luscious Lou, and we'll say our goodbyes.
All right. Well, you know, there are people out there every day. They're struggling. They're looking for something to grasp hold of. I know you're out there, and you're not at that level that you know you could be, that you're out at your optimal level. And I know you're sick and tired of, you know, being lied to. Let me tell you, there's hope out there. There is hope out there, because there are people that are just like myself and Dr. Matt Malonis, you know, that we care. We care about people that are just like yourselves, because we have the intention to know and doing what we want to do is right for you. And it's not just our intention, but it's all within our whole realm of what we believe and how we want to impact the world. And then it takes not just you or not just us, but it takes you to be with us to go part of this mission of getting sick people well. And even the sick people that are sick, they can have hope and they can have their dreams again, if they just do and they make a commitment. But if you give it to them and you just help them walk the path, then we're talking about creating an entire movement within the world, and it takes everybody, not just the healthcare professionals, but it also takes the patients. Because just like chiropractic, it wasn't the doctors that just kept the chiropractic alive. It was the patients and the testimonies and the miracles that happened every day in the offices that we came from that kept chiropractic alive. Well, that's the exact same thing that is happening with hyperbaric, because sick people are getting well. Parents are getting their families back. They're getting their children back. They're getting their grandmothers back, their families back, their lives back. And what is that worth? It's worth everything in the world.
It's everything, man. And listen, we feel your heart. If those of you, this is your first experience, this is a man who cares about people. And so, Lou, with the Pain Sucks podcast, our slogan is that no one gets to tell you that you can't heal. And dude, you just plugged in another piece of the puzzle for the people that are looking today, man. And I hope like crazy that your week sucks because of everyone calling you for machines and putting in their office. And that would be such a blessing for this country and this world. So, Lou, thanks for being with us today, man. And have an awesome day. All right, everybody, be blessed.
Thank you. Have a blessed day.
See you, man.